Welcome back to Long Covid Doctor, an educational series for sufferers of long Covid. I'm Dr. Tim Robinson, formerly a family doctor, GP for 30 years, now a long Covid specialist. This is the second part on chest pain and long Covid. In part 1, I talked about the symptoms, diagnoses and investigations. Here in part 2, I will talk about specific chest pain occurring in long Covid, the so-called Covid grip, and its treatment and the outcomes. Excuse me. As I said before, check out the references and resources and links to social media in the show notes below if you should wish. Just to say, any advice, diagnoses, treatments that I mention should only be considered after discussion with your own doctor or medically qualified health professional. So, here we go. Part 2 of chest pain and long Covid. As I said in part 1, I covered the 5 types of chest pain that our patients could be experiencing, the red flags and the diagnoses. And just to remind you, the causes of chest pains I grouped together as 4 serious ones, the 4 serious diagnoses needing hospital care, secondary care, namely angina, pericarditis, pulmonary embolism, pneumonia. And then there were the 4 less serious diagnoses that can be handled by general practice, family doctor, primary care, namely costochondritis, intercostal muscle pain, rib margin pain, and finally the chest pain in long Covid patients due to pleuritis, inflammation of the lung lining. The patients have labelled and referred to as Covid grip or lung burn. I'll explain about this more fully now. The lungs are surrounded, encapsulated in 2 layers, the visceral layer and the parietal layer, the pleura. And there's a space between them that contains serous fluid. So they glide normally and freely with normal breathing. In long Covid pleuritis, there is inflammation of the lining of those layers. Those layers no longer glide freely, smoothly with breathing. And this makes the patient feel like their lungs are tight, that they're hot, they're burning. It's a burning sensation across the whole of their chest. And so, what's the cause for this long Covid chest pain, this Covid grip? What's the pathophysiology, to give it the fancy medical term? What are the explanations? First, there's some, I'd like to give you some background information about inflammation itself. When there's inflammation, we've referred it to an itis, okay? That's pericarditis, that's inflammation of the pericardium, the sac that lines the heart. So it's an itis. And then inflammation of joints, we call it synovitis. That's inflammation of the synovium, the synovial membrane. And then there's inflammation of the lining of the brain, the meninges, that's meningitis. And so, not surprisingly, inflammation of the lining sac of the lungs, the pleura, we call that pleuritis. And this is all part of the general inflammation due to Covid or long Covid. The reasons for this we're all familiar with now. There's the dysfunction of the innate immune system, overactivity of the inflammatory response, causing inflammation of the lining of the lungs, inflammation of the air sacs themselves, inflammation of the blood vessels lining surrounding those air sacs. Other possible contributing causes in the long COVID setting are excessive smouldering inflammation that causes microthrombi. We refer to as the hypercoagulable state. Too much coagulation leads to formation of these mini blood clots in the alveolar capillary bed. With excessive inflammation, that leads to mast cell activation in the lung tissues themselves, activated as part of the normal innate immune response, but it's excessive, and that contributes further to the inflammation. Then there's autoantibodies directed at the pleural membranes. Autoantibodies have been discovered that are specific for the lining of the lungs. And then to compound all this, there's obviously, and I'm sure you've heard of this, viral persistence of breakdown products of the SARS-CoV-2 virus. And there are reservoirs of these around the body that have been found in the gut, for example, or thinking, this is obviously a talk on chest pain, there have been remnants found in the macrophages, the defense cells, in the lining of the air sacs, the alveoli, that obviously fuel the inflammation. And then, again, another problem that arises as a consequence of long COVID is the disturbed gut microbiota, the friendly gut bacteria needed for support of our immune system. So these are all the processes that may be present to different degrees, each contributing to the general ongoing inflammatory state of long COVID, which includes, of course, in this context, in this talk, inflammation of the lining of the lungs, the pleura, resulting in pleuritis, and consequently experienced by our patient as COVID grip, that tightness, that burning sensation of their rib cage generally. And so what is the treatment for COVID grip? Well, any inflammation anywhere, what do we do? How do we treat it? Well, if you've got a bruise or a painful joint somewhere, you use an anti-inflammatory drug, don't you? So a non-steroidal anti-inflammatory drug, more specifically, such as ibuprofen, 400 milligrams, 3 times a day. Obviously, people aware of the risk of stomach irritation. Be wary if you've had a stomach ulcer in the past. You may need to have a PPI drug, proton pump inhibitor drug, given at the same time to protect it against gastric irritation. So if you like, that's the non-specific anti-inflammatory drug which we can use for inflammation and itis, pleuritis. But more specifically for COVID grip, we've got colchicine. Now, colchicine, it's an ancient drug. It's a treatment for acute gout. It's derived from a plant, from something called the autumn crocus, and the ancients, so the ancient Greeks knew about this. The ancient Greeks back in 1500 BC used it for joint swelling. Back in the 17th century, the apothecary Nicholas Culpeper listed colchicine in his compendium, the English physician. So, like I said, it's been around for hundreds, almost 1,000 years, thousands of years. So, what I'm saying is, it's been tried and tested. In general practice setting here, back in the 21st century, it's really only used for acute gout by family doctors, GPs. And as I said, it's safe tried and tested. We're all familiar with this. However, it's now also used by the cardiologists for pericarditis. And this has sort of slowly crept in over the last 5, 6, 7, 8 years. And pericarditis, I'll just remind you, inflammation of the lining of the sac that the heart sits in, the pericardium. So the cardiologists led the way on this. So cardiologists treating patients, long COVID patients with pericarditis and cardiac complications as a result of their acute COVID, prescribed colchicine for the pericarditis. But what they noticed is that their long COVID patients often reported an improvement in their general chest pains, their COVID grip. So, hence from that, the use of colchicine crept in for pleuritis, which is great news. Colchicine is well tolerated, has very few side effects. The commonest is diarrhea, and so obviously you know about it if you get it, but it's usually with the higher doses and prolonged use. There are a few other side effects to do with muscle inflammation, can cause the white blood cells to be reduced, can cause kidney problems, can cause liver problems. This is all very rare, but these things should not be a bar to using them. Obviously, because of those potential side effects, we ought to be doing a kidney and a liver function test at the start if we're intending to use it for a period of time, and then repeat those blood tests, say 4 weeks later, and then thereafter annually, according to the cardiologist. They're comfortable with that. Dose, very standard, 500 micrograms twice a day, maybe 4 times a day. Again, start low, go slow. Duration, 3 months may be enough. If not, discontinue it at that time anyway. If the COVID grip comes back, then it's just very simple. Start it up again. Run it for another 3 months. Cardiologists say that in their experience, the patients need to take it for 9, maybe 12 months. Anecdotally, patients tell us in our clinics, that it also helps with fatigue, general fatigue, as well as brain fog. Why? Well, maybe it's general effect. Maybe the colchicine is having a general effect on inflammation. Probably is. Or maybe the reduction of their symptom burden improves their general well-being. Either way, patients appreciate the recommendation and the treatment if they've got this COVID grip. Certainly experience from long COVID clinics that I work in. As I said, the chest pain is common, and we see patients who have had their chest pain checked by the hospital. So chest pain excluded, the serious stuff, the anginas and the heart, the blood clots, and pneumonias, all excluded. And then they're discharged from hospital, but with no specific treatment for their COVID grip. So what next? As serious, causes have been excluded, why not trial colchicine? So that's the specific, if you like, specific targeted treatment for COVID grip. But what else can we do to help the recovery from long COVID? I think it's important to take the whole person holistic view. We need to think about other things for that whole person general recovery from long COVID. We need to think about, say, nutrition and sleep and mind body. So nutrition, what should we all be eating? excuse me. Well, basically, I think we should all be eating a mixed, balanced diet, the Mediterranean diet, that contains all the necessary minerals and vitamins, the building blocks for cellular and tissue repair, as well as anti-inflammatory, antioxidants, the polyphenols, the things that make your fruits all those interesting rainbow colours. A mixed balanced diet, a Mediterranean diet, will also provide prebiotic fibre to nourish your gut microbiota, the friendly gut bacteria. I cover this more fully in my talk on Long Covid gut. A healthy gut flora is so important for immune support, production of vitamins, hormones and neurotransmitters. And then still on diet, think of omega-3 essential fatty acids, so omega-3 fish oils, for immune support also. And finally, of course, vitamin D, just for good measure. After all, we live high up in the northern hemisphere. We're relatively sunlight starved, especially in the winter months. So that's diet done. We've got to think about sleep as well. As we know, sleep is the great healer, according to Hippocrates, father of Western medicine. He knew a thing or two. Sleep is so important for refresh and repair. We must support the day-night cycle, the circadian rhythm, for various restorative hormones are released, such as growth hormone, that is released mostly whilst you're asleep. We've got to think about sleep hygiene and the sort of strict bedtime, strict sort of get-up time, a sleep-inducing novel rather than mobile or screens before going to sleep. They emit blue light, which is arousing, not relaxing, like pink is a relaxing colour. Piriton, magnesium, melatonin, these are all medications that can be taken, all available over the counter or online. They're safe. I cover this in my talk on sleep disturbance in Long Covid. So that's diet done, nutrition and sleep. I think it's important to tackle worries as well. The turbo brain, anxieties. These all lead to fight and flight, adrenaline, the sympathetic nervous system overdrive. We need to address these. We need to consider mind-body techniques, such as mindfulness. There's the Headspace or Calm app that you could download and put on your phone. It's cheap. And there are many proven studies that demonstrate that mindfulness reduces stress, reduces anxiety. Whilst we're talking mind-body, think about yoga, tai chi. Again, many studies prove that stress, anxiety, blood pressure are reduced with those practices, yoga, tai chi. They incorporate focus and breath control and coordination and general body reconditioning. And then finally, thinking sort of the general holistic approach, we've got to remember fatigue management strategies, pacing, planning, prioritizing, pacing, the process of balancing activity, that's physical as well as mental and emotional activity, with rest, balancing all those activities with rest. Pacing gives you an awareness of your limitations, knowing your baseline, to work out what you can work to that baseline, that limitation. Not too little, not too much. So you can plan how to use your energy most efficiently and effectively. Pacing means basically no more push through. It's stop, that's enough. And I cover this more fully in my talk on fatigue, long COVID fatigue. Beside all this general advice, there are a few trusted resources for long COVID recovery. Then there is the website, the NHS England website, NHS Your COVID Recovery, which is a self-help patient resource for symptoms and information and self-management. So yourcovidrecovery.com. The Royal College of Occupational Therapists have got some excellent resources of how to manage post-viral fatigue after COVID-19. So that concludes the second part of my talk on chest pain with long COVID, following on from the first part earlier. I hope you found them both helpful. And as I said before, check out the references, resources and links to social media in the show notes below if you should so wish. Again, as I mentioned at the start, any advice, diagnoses, treatments that I mention should only be considered after discussion with your own GP, doctor or qualified health professional. So in the meantime, I wish you well for your long COVID recovery. Cheerio.